and welcome back to Shrivas Talks. And today we have with us our esteemed guest, Dr.Dheeraj Kodali, who is very experienced and has a lot of different certificates with 8 years as a fully fledged physician. He is quadruple board certified in the following fields: internal medicine, adult psychiatry, hematology, and medical oncology. Sir, I'm very glad that you were able to take time out of your very probably busy schedule as a doctor to join here today. So I thank you so much for coming today.
My pleasure.
So I just want to start off by asking, how are you feeling today, sir? How is your day going?
Day as usual. Nothing unusual about today. Usual middle of the week, end of the week schedules, office time, and I'm here happy to share my thoughts and experiences with you.
So I just want to start off this conversation by going into like the early life, like the whole process of what made you become a doctor. Like, so your high school education, and then what inspired you. Were your parents also doctors? And then like the degrees you had or where you studied, that kind of thing.
Right, I hail from a city in state of Andhra Pradesh in India called Vijayawada. That is where I grew up all until high school. So yeah, for me the biggest push of being a doctor was because both my parents were doctors too. They were both practitioners. My mother was a gynecologist and my father was a general practitioner. So they had their own office practice and clinic. So I used to remember days when my mother used to deliver babies and come late in the night at 2 o'clock. I used to wake up in the middle of the night not finding my mother sometimes in the bed. So I had all those experiences happening over time, but I understood that what her role in her career was also very important. So we used to miss her, but we still used to understand that was part of what she wanted to do. So I felt like I was in the whole process of service and treating people and all that at that time. So I think it kind of drove me towards it. Interesting thing is, as I went through high school, I was suggested by many of my parents' friends and others to do something little easier than medicine. Because they all went through medicine, they suggested it is a tough field, so don't go to it. And because we were actually the Y2K generation, we did all our grades around 2000, where the whole boom of information technology and computer science came out. So everybody was going. Actually, 90% of our class actually went into that fields. So it is interesting how everybody pushed me towards it, but somehow after all the wavering back and forth, hitting back and forth, like how high school does for us, I finally went back to going into medicine. So I did usual exams for the entrance, as we call it there, into medical schools, and I did my medical school there and finished it there.
So what kind of entrance exams you had to do?
So here, I think our generation knows it very well. We have a very structured system of entering into medical school there. The interesting and the different thing what we have from here to there is, there after you finish high school you can directly get into medical school. So my first year of medical school was right after 12th grade. But you have to write an exam that is about like 3 to 4 hours. It's based on multiple choice questions based on all your high school curriculum, a little bit based on biology and chemistry and all those fields more than physics and such. So they give an exam, you write the exam, and then you get your score and they'll rank you. And once you get a rank in that, it can go anywhere from 1 to like 100,000.
That depends on how many people.
Correct. How many people wrote it and where your score is among all of them. Mm-hmm. And then you have all these colleges having their positions. And then each of them will kind of, not really interview, but you'll be allotted to a certain class based on what you pick. If you're rank 1, you get to pick whatever. If you're rank 100, depends on where the people in front of you pick. And then so and so.
Okay. And this is all in Andhra?
Yes, in Andhra. Yeah.
And so you did, like, is it like directly, do you have to do like a bachelor's type of thing?
No, actually we don't. Actually, medical school is kind of a bachelor's and master and doctorate, everything combined together in a way. There it's called, that's why it's called MBBS. It's like actually Bachelor of Medicine and Bachelor of Surgery.
And so there's no like specific major or anything?
No, yeah, in the inside, so it's basically how medical school here works. That the system here is different. Is you do undergrad, you complete your bachelor course, and then medical school is like a doctorate program here. Whereas medical school is a bachelor's program. So the curriculum is pretty similar here and there, but it's just labeled differently because of where you enter the school itself.
So, but like here, there's extra 4 years.
So you do pre-med here, you do some majors in like some biology-based fields and things like that here. So that's the difference. You do undergrad for those 3 years, you get into biology fields, and then you develop some credits, and then the common thing here and there is here we have MCAT, which is medical college admission test, and there we have that entrance that we're talking about. So both of them kind of have that, but the difference is there. Everything is based on basically the entrance score, and nothing else matters. I mean, whatever else you do, that score really places you in that rank. Here, MCAT is important, but it is only one of the things they consider. And they look at everything else along with that, and your profile, what you did, what volunteer works you did, and how you're kind of shaping your undergrad time and what you're interested in. All that kind of matters for the interviewing person in the medical school to decide whether to offer you a position or not. So you have a little bit more than 1 3-hour or 4-hour exam that will determine basically your career.
But if we do happen to not do well on the exam, can we write it again? Or is that
I think you have medical college admission test. I think they give it twice a year, so you can write it, I think 2 or 3 times. Maybe wrong on that, but yeah, I think at least more than once you can definitely write it to improve your score if you want to. But like I said, it determines only one piece of your admission profile.
Mm-hmm. Oh, in India?
Even here.
Oh,
because of the MCAT, yeah. Oh, for you talking about India, if it's in India, it's only one time test. You can do it one more year later, but you have to wait for the whole year, and then when the next time the exam is done only once a year. So you just have to kind of apply for it next year. You can do it again. Sometimes people who don't get into colleges they actually wait for a year, do it again, and then try to get in a better score and a better rank.
Is there like a number of limits of how many times you can do it?
Actually, no. It's funny. I when I was in like high school, end of high school, when I was giving exams, I sat behind a guy who was writing it for the 5th time.
Oh, okay.
So I never thought people would write so many exams, but yeah, they do. But it's in the minority. Most of them do 1. Probably a small percentage do 2. Rarely 3, 4, and 5. But yeah.
Because it seems like a lot of pressure on like one exam deciding the whole future, like your whole path, everything.
Right. Yeah, there is a lot of pressure. I'm sure all of our generation understand that pressure because it's not only the pressure on the kids, it's also pressure on the parents and how they kind of shape their kids, because it becomes such an important thing.
I heard that a lot of people like they had to study for 16 hours like that. Was it all this?
Probably 20 hours sometimes.
Oh, wow.
Yeah, for this last 2 years of high school, I think all they do, sometimes they don't even go to classes in those high school times. It's all about preparing for that particular 3-hour exam.
That's really scary that the whole future is based on 3-4 hours.
Correct, yep. Yeah, and you can have one bad day and everything changes, that's why.
And then, so after going through like the 4 years of medical school, what came after that?
So usually, so that gives us our basic degree. So you can practice with that in India, but I kind of chose to come here for a lot of different reasons. My sister was already here. She's an engineer working, so I wanted to come here to see the fields. So I came right after medical school. I spent 1 month in a couple of hospitals here to see how they run and how they teach and how we can learn from them. I felt the system was very sophisticated. It was, because I think the difference between Indian system and here is India trains you to be a very street smart doctor. Like, even without resources, you can do a lot of things. You help the patients because the volume of patients and the number of doctors are very disproportionate. Here it is more it's very much based on the book, guideline based, and they're very careful about how they do things, and it's more patient-centric here compared to there. So I like the system here, and I felt like I will learn better if I do in a system like this. Nothing against Indian system, I still love it. I think they're probably one of the best doctors I've seen and learned from. But I feel like there is more setup here. So that's why I came here and applied for post-graduation. I did my master's in public health for 1 year, and then I went into my specialty after that.
So I have one question. So
Sure.
even if you didn't go into the postdoctorate would you still be able to practice as a doctor? Or?
In US, you cannot. Although you finished your medical school there, you will have to write some exams to clear. They are called USMLE exams. They're basically an assessment exams for all the medical school students here also give the test. Basically like an end of medical school test to clear it. You have to clear that, and then you get a certificate saying that you've cleared it. And then you have to get a license in one of the states before you can practice. But almost nobody here stops at medical school. They always go into the next step, which is the specialty that you do, which is either the gynecology, pediatrics, or family medicine, internal medicine, things like that.
And like your specific situation, I remember there was like 4 different.
Right, so I basically always had interest in learning about the whole body, like mind and the body combo. So that's why I applied for certain specialties which are combination. So internal medicine is basically adult medicine, and then psychiatry is basically mental health. Mm-hmm. So I kind of did the post-graduation in both of them. So that is why it is usually most post-graduates are 3 years, mine is 5 years.
Oh, because you have to.
Correct. So I had to cover both curriculums through that 5 years.
And so, this is just personal curiosity. Did this also cover homeopathy by any chance?
No, actually, unfortunately not. We don't have any homeopathy here, right? And there's not a lot of teaching of homeopathy happening here. When we are in India, we used to have a few months of homeopathy experience as part of our medical school. But not all medical schools do that there. It's separate, allopathic and homeopathic.
And then after that, you went into the oncology.
So the current specialty that I'm working in. So you always do a specialty and then you do a subspecialty, which is basically more specialized under that field. Mm-hmm. So I'm right now treat patients with cancers and blood disorders, non-cancer or cancer blood disorders. For that you have to again train for another 3 years. So that's what I did after I finished that first 5 years.
And this is also the hematology?
Correct. Hematology basically is blood disorders and blood cancers, and oncology is basically all cancers and treatment of cancers basically.
Because I don't know any of the specialized terms.
That's why I'm explaining so that you all understand. Yeah.
And then after that, you are just instead of doing the postdoctoral, you're just working as a...
Correct. And you can do more, you can do research afterwards. You can join as a assistant professor in a university to do teaching and research. So there are different options after that. So most people either practice in a private group like I'm doing right now. We have 10 oncologists in our group and we cover different towns and we take care of local cancer patients there. And there's a subset of doctors who go to the bigger university like Stanford or UCSF, and they work there as faculty. And they also obviously treat patients there, but they also teach like residents, like how I went to residency and subspecialty. They teach us there.
So they work as professors. Correct. That's the other option.
Correct. So you have community groups, private groups, or there is the university academic groups that you can.
And so are these groups always affiliated with a hospital or?
Most of the time they are. So for example, our group is completely private, so it's owned by us, as physicians, and we run it. We have affiliations with basically all the hospitals in the community. Because that is how we help the hospitals treat patients, and they also help us by admitting our patients when they are sick and they need to be admitted. So it's more like a symbiotic relationship between a group of physicians and a hospital that's localized serving the community.
So there's no official building type of thing?
So we have an office, we have an office building that we do. Oncology is unique in the sense that we not only see patients in the office, but we also do treatments for them in the office.
In the office itself?
Correct. So all the cancer treatments happen in the office too. Rarely we do them in the hospital, but sometimes we have to admit them and do them in the hospital, but most of the times they are done as an outpatient. They see us, they go get treatment and they go home. And then we come back and see us for the next treatment. So it's more like that.
So in the office, are there more specialized equipment there, or is the hospital more?
No, we have our own equipment for giving treatments for that. So they're usually bags of fluid and injections that we give for cancer patients. So we buy all of them as a part of our inventory, and then we use them when patients come in, and we build insurance to get the reimbursement for that.
So there's specialized equipment that you cannot generally find in the hospital.
Correct. Yeah. So not all hospitals can give cancer treatments. Two reasons. One, because they need an oncology nurse who knows how to handle cancer. Because after all, cancer treatments and most likely chemotherapies, as we call them, are basically anti-proliferative drugs, which means that they basically kill cells from growing. That is how cancer is basically an abnormal proliferation of cells. Just
like a mutation.
Correct. And then it just grows and grows and grows where it shouldn't be. So to kill all that, we have to give chemicals. The chemical is basically chemotherapy. In a short and not a nice way, it's basically a poison. But not for the cancer cells.
Okay. So I'm just imagining that daily life is really hectic as a doctor.
It is, yeah. I mean, generally doctors' lives are generally hectic because there's a lot online, right? You go in, you say, okay, do this, you'll get better, or don't do this, you don't get better, and so that the stress of that is immense and a lot of responsibility. That's why the training should be so clean and good. Otherwise, you are actually trying to help somebody who's either going to die or who's very sick and he needs help, and we want to make sure that we are ready to do that. And so it is stressful in a way. Yeah.
And especially since in your field, it's like more high level and more.
It is because we are literally taking patients who are like very close to death and trying to bring them back. So it is, and we deal with a lot of negativity and stress in that because of that. It's a hard field, but I think we are probably the only field that can actually say that we're doing something to help the patient's longevity in the end of their life. I think sometimes we feel. I have older patients who have cancers who come and say, just keep me alive until my granddaughter graduates, or keep me alive until they have a kid. I mean, there's a new baby coming in 6 months. I want to live until then. So their goals are very simple, and my role is, although it is very complex, I have a very clear way of looking at those things. So it gives, at least as an oncologist, it gives me pleasure in doing those small things for them. It may not be a big thing when you look at it, it's only 5 months, 6 months, but for them it'll probably mean the world. So
I think that's a really noble way of looking at it, giving those people at their last moments like that happiness.
Right, yeah.
Is it really emotional when you have to take it?
Good question. I should say yes, and also no in a way. I mean, the more you feel emotional about it, I think it will affect you internally also. So you have to be careful. Mm-hmm. I think there is a fine line being empathetic about what is happening in front of you. You want to feel their pain, but you don't want to get too involved. So you want to find that space because you don't want to carry that home, because you have your own family, you have your own parents and kids and spouses to take care of. So you don't want to bring it to them. That's the biggest thing, is you have to find a way to kind of separate those two buckets out. You'll learn, because this is what you'll be doing for almost 10 years before you get into full-fledged practice. And sometimes it takes a few years after you start practice to figure out your way of separating them out and helping yourself manage better. Because if you do well, only then the patients will do well. Because if you're not able to function well, the patients cannot do well. So it's automatically, you are forced into it almost.
So you have to know when and how to draw that line.
Correct. I mean, you should definitely empathize with patients, and there is no second thought about it. But it should also mean that you shouldn't carry their burden. You should try to find a way to kind of separate. And there is no good method to do that. You just have to find. You should know yourself better. You should understand what your emotions are, how you feel about it, and try to adjust it.
Listening to this, I don't think that medical would be very good for me because I'm actually kind of very emotional. So.
Okay. Well, you never know. You maybe so my wife is a child psychiatrist, so she works with kids who have mental health problems. So I also felt when we were because we knew each other from back in medical school in India. I never felt like she would be able to do that, but she's doing it really well. She's also very emotional, but at the same time, I think she finds the space. I think she feels like she's connecting with the kids who are suffering and helping them. So you never know. I think you should give yourself a chance to see how you would get exposed. It is it's very rewarding, but it is tough. I'm not saying it's not tough at all, but it's tough, but it's very rewarding. And I think you there is something in psychiatry that we call altruism, which is, I mean, you've heard the word too,
Yeah.
right? So altruism is a form of defense actually. Sometimes we, instead of bottling up some of the emotions, we try to help somebody else. So this is like, if you really have that in you to help other people, you can do it part of your career, right? I mean, you don't have to do it. Like if you work any other field, you can't really directly help people. You know, you have to be outside work. You, like, let's say you help an NGO, you work as part of an NGO and do things, or you do your self-go. But this is probably the only field across all the fields that you can actually have a career of service, like direct service to patients. So it's very rewarding in that sense, and that is what keeps you going all through. Despite the negative, despite the stress, despite the hardness it shows on the outside, that reward inside of how you can service people day in and day out, it's just very, very exciting to go through, despite all the hardships that the field faces.
I think that doctors, like I've always admired them because they seem very, very selfless. And I think that's really hard to be, like, especially when you're helping others and you don't really expect something back from it. I think that's really cool.
Right. Yeah, I think it's also true and not true in a way. I mean, obviously we get paid to, right? We get our salaries and we get our money from insurance companies. So it's all there. I think the difference is you shouldn't be working for money. I always tell a lot of the students I know, or my cousins, kids who want to go into medical school, don't do medicine for money, because money will follow if you're able to do well in your field. I know all movies say this, but the reality is, if you're able to work passionately, patients will come to you because you're giving them the best care, and they'll know that. You think that patients don't know. Patients always know who's a good doctor and who's not. Sometimes they don't have a choice because they don't have a different doctor, but when they have a choice, when they see a good doctor, they'll stick to it. And I actually was working in Stockton the first 2.5 years of my, once I moved to California. After 2 years, I moved to Tracy and Modesto because it's closer to home, and also because we are expanding our clinic. At that time, a lot of patients, actually, I think almost 50% of my patients wanted to come out. They never traveled to Tracy to see a doctor, but they traveled to see me. And still some patients still come and see me. I keep telling them, I'll find you another doctor in our group who can do the same group and all. But they don't want it. So, sometimes you get that connection and you trust the doctor, and then you feel like, so all that becomes important in practicing medicine too.
I think this also kind of applies to all sorts of fields. Like if you can do well in that field and you can make a connection with that people in that field, that I think that's like really wonderful, and that's like that in itself is a good success.
Yeah, and then you'll grow that way. I think you want to grow in career, or you want to become better, or you want to earn more. All that will kind of follow that whole path. Whether you're a good architect or whether you're a good engineer, the way you grow is to do well and connect with everybody around.
So this is a slight change of topic, but I was also kind of curious about how, like, a day-to-day basis, how your day goes, or like how your week goes.
So mostly I think almost all physicians have a very similar pattern. We have an office practice, right? So we start at like 8:30 in the morning, and then every 15 to 30 minutes we see patients. We have appointments scheduled, and patients come in, we see them. We suggest things to do, whether it's blood tests or scans or treatments. Those things will happen through the day. Usually we have an hour of lunch break. Sometimes we have conferences during that time we attend. But it's like, nowadays it's all Zoom conferences, but we used to go to the hospitals and attend those conferences. There's something interesting in oncology. We do it's called tumor board, where like 7 different fields of patients who treat cancer come together, talk about a patient, make a form, make a plan. So that happens during the noon time. And then afternoon also we have more patients in the clinics, and then after we finish up and we go. Now some fields, like our field, we have something called on-call, which means that you are supporting patients after hours or on the weekends when there is no doctors around, or hospitals sometimes call us saying, okay, you have this patient to see because this certain new cancer came up and this new blood problem came up, and then we go and see those patients on those days. So I work sometimes every 4th or 5th weekend. I'm on call. It means that I cover all the hospitals around this area. We go around. on that day and see patients in the hospitals, and also help the clinic patients if anybody needs anything on the weekends, because we are closed on the weekends. The whole office is generally closed. So that's the part of the extra things that we do. But otherwise, I think mostly it is all office based, 8:30 to 4:35, and with an hour break, and sometimes do conferences in that time.
So it's like a Monday to Friday.
Yeah,
time.
it's a Monday to Friday. Unless we are on the schedule for being on call, we usually are not.
So does it ever like extend past like the appointment time?
Always, yeah.
Oh.
Sometimes, you can't determine how much the patients want to talk to you also, right? The time is only 15 minutes, but I can ring a bell and say, okay, go.
Yeah.
So if they have an issue, something that needs discussed, something they want more clarification on, the time goes on. Sometimes we finish later. Almost every day I never come back home before 6, but that is more because I try to finish my work before I come home. And so I don't like to bring it home and do it at home.
This is more about like the work and home balance.
Correct. And this is very important, especially in being a doctor. You want to try to restrict yourself to work things at work, home things at home. Because at some point in time you can consume both. And I think our generation and your generation also should be very careful with that, not overdoing one thing over the other. You're passionate about something, do really well in the time that you have for that, but also have time for yourself and do other things with your family, so you can balance both off. Only when you're good, like I said, internally only when you're good, only then you can do well in any job. It doesn't have to be doctor related stuff. If you're stressed out in your individual life for whatever reason, it's going to show on your work. So you don't want them to you want to try to separate them out enough that you can do both.
And so, what kind of things do you like to do outside of, work?
I'm very simple. I don't have too many things. I like to hike. So I actually like to hike in nature. I just go and hike with our family or some friends. I like to play cricket. So that is my other interest. So we play, on weekends sometimes, where we play a game for 2-3 hours. And then the third thing I do is I watch a lot of movies. I'm a big movie buff, so that's all I do. If I don't do either of those two things, and whatever I do except for the cricket part, I like to do it with my family or friends, so that it's a collective thing.
So like for the movies, do you watch in English or like general?
All of them. You can actually watch any language movies. Mostly it's English, Hindi, and Telugu movies. But I watch pretty much everything.
Did you watch the new Jurassic World movie?
I did. I had to take my kids for that.
Because I've been meaning to watch it, but I haven't gotten around to it.
Yeah. It's actually, if you watch the old ones, it is very similar. Mm-hmm. It's a good, fun movie to watch. You see all these nice VFX on dinosaurs and all that stuff.
Is it kind of scary or like?
Not for you.
Yeah, but for maybe the younger kids.
Yeah, the younger kids. Yeah, my daughter got scared a few times. She's 8, but yeah. Other than that, I don't think it'll be scary.
Okay. Because I've only watched like one of the earlier ones a long time ago, so that's why I don't remember.
Yeah, you should be fine. Yeah, it's good to watch these movies sometimes.
Okay. So I think this is going really well, and I want to move on to the last segment of the podcast. I think I mentioned this before we started, the introspective part.
Right.
Yeah. So the first question is, how do you define success?
So if you're talking about a field, right, as a doctor or an oncologist, success for me is a patient coming back and telling me, okay, I was able to do something because of you. For an example, I had a patient, I had a 78-year-old patient who had a cancer. And it's a very advanced cancer, and normally with those cancers, even with treatment, they don't survive more than 6 months or 8 months. So he basically gave me some goals. He said, okay, this is what I want to do. Can you make it happen? And honestly, as a doctor, we can't tell all this. It's not really in our control. I just said, I'll try. We don't know. But luckily, whatever treatment I prescribed for him, he took it and he responded, and he had good 2 years of time. Unfortunately, he's no more now, but the last visit before he actually passed, he came back to the office just to meet me. We didn't have an appointment, he just came to meet me. He said, thank you for doing what you did. I did all these things, and this is completely credit to you. And I couldn't have done it. If I had gone to any other doctor, any other oncologist, even my primary care doctor, they all said, 6 months is all you have. So you did it. So that is basically success for me.
I think that's really amazing that your patients were able to, feel like safe enough to come back and
I tell you, yeah. And it's usually, you don't. I mean, money and status and career path and becoming some kind of big deal in some practice or hospital. Those are all good things. Those are all also considered successes. But for me, the ultimate success basically means if you're able to do something for your patient and they come back and say that, okay, thank you for doing this. I think that is more success than anything else.
That's really cool. I think this can also apply to many other fields as well.
Absolutely.
I think for a while back, we had my former teacher come in, and she said something similar. I think having your students come back to you with oh, I'm doing well in this field now, that kind of thing. So having that interaction, I feel like that's really important no matter what field.
I agree. I mean, we actually had a 25-year reunion for our school back in India, our high school. So we all went back and we all told our teachers what we're doing. And obviously, I think most of us agree that our school education is what shaped how we are right now. So they were really thankful for that. And I think they really should get the credit for that. I think teachers' job is probably the hardest ever for anybody. So yeah, I agree with her 100%.
So I also want to ask one more question.
Sure.
So we went over success. I also want to ask, how do you define wealth?
So wealth, okay. So tough question. So wealth, I think for me, health is wealth. Yeah, there is nothing more important than health. Everything else comes. House, car, money. Anything, eating out, going to movies, traveling elsewhere in the world, everything can happen only if you're healthy. So if your health is protected and you do it earlier in your life, then your later part of life becomes wealthy with whatever you want to do. Whatever you saved, whatever money you saved, whatever houses you got, everything will make sense only if you have health to actually enjoy or take care of them or, spend time in however you want. So for me, health, basically wealth is having good health, and everything I think will follow. If you have good health and good intentions, I think wealth will also follow, like actual wealth will also follow you.
I think coincidentally my mom said something similar this morning. So, it came out of random topic.
So, I think we all have the similar ideas about what is important, right? Yeah.
I think this has been a very good podcast, Uncle. So I'm very thankful that you were able to join us again. Thank you so much.
My pleasure again, and good luck for everything that you do.
Oh, this is just a small drawing I made.
Oh, you're drawing for me. Thank you so much.
Do you want to look at it now?
Sure. You want me to look at it now?
Yes.
Sorry, I have a problem with ripping things because I feel like somebody really did a good job in trying to do this, so I don't like just ripping it out.
Okay. Because I generally just rip it. It's the wrapping is very well done.
Yeah. So somebody did it with care, so try to at least, if I can. Oh my God. I don't think anybody made a picture of mine. Very nice. So close. I mean, it's probably the best drawing I've ever had of mine. I never had anybody draw me. It was all caricatures. So does it look? It looks very similar to me, I'm sure. Thank you so much.
Oh, can we?